Good afternoon to all of you, and welcome to the GMO Academic Cow program. Today, the topic is much different than the previous days. So the topic today is impact of artificial intelligence on future healthcare. So we have invited Dr. Dayan Rajapakse to deliver the lecture. Let me read his bio before the lecture, before he start the lecture. So Dr. Dayan Rajapakse is a distinguished figure in the field of education and also in IT. He founded ESOFT Metro Campus in 2000 and currently serves as its chairman and managing director for the ESOFT Group. Alongside his leadership role, he imparts knowledge through lectures in various programs, including MBA, MSc, BSc, and also BIT. His educational journey began at Malayadeva College in Kurunegala. Then he completed his MBBS from the University of Colombo. However, his passion for IT and teaching started after he finished the BCS professional examinations, even before entering the medical college. He also holds a postgraduate diploma in advanced software engineering from the University of Westminster, UK, and MBA from London Metropolitan University, UK, and an honorary fellowship from Kingston University in London. In 2021, Dr. Rajapakse received 2 prestigious gold awards from the Federation of Chambers of Commerce and Industry of Sri Lanka, recognizing him as the Entrepreneur of the Year in the extra-large category. Dr. Rajapakse's contribution extend beyond ESOFT. He held key positions at the Computer Society of Sri Lanka, that is CSSL, and served as president of both CSSL and the Southeast Asia Regional Computer Confederation, that is CEARCC. Currently, he is the president of the Sri Lanka Association of Non-State Higher Education Institutes and holds the position of senior vice chairman at the Federation of Information Technology Industry, Sri Lanka. So let me warmly welcome Dr. Dayan Rajapakse to deliver the lecture on impact of artificial intelligence on future healthcare. Over to you, Dr. Dayan.
Very good afternoon to all of you. So I'm really delighted to do this presentation on impact of AI on future healthcare. So actually, although the topic says impact of AI on future healthcare, I think already it has caused significant impact on healthcare. So as we go through, you will come to know what kind of impact is created from AI, artificial intelligence, on medicine and healthcare. So I'm not a real expert or researcher in artificial intelligence, but I have basically done some lectures in AI. So I know what are the updates and what the trends in AI are. And also, since I'm coming from a medical background, I'm also interested in seeing how AI is applied in healthcare. So that's why I thought, this topic and selected this topic because if you take AI is going to cause a very significant applications in healthcare. So actually, if you look at one of the most dominant area where AI will be used in future is healthcare. So therefore, as practicing clinicians, doctors, you need to know what's going to happen and what is going to be the impact of AI on healthcare, because better to be aware of that rather than staying aware of it, because we all know that technology is going to have a lot of impact to our lives. So to your profession also, it is going to have an impact. It doesn't mean that it's going to create a threat for you, but we will definitely have to change the way that we work. That is probably why you need to keep yourself updated. So let me run through what I'm going to cover on today's lecture. So first of all, we talk about introduction to AI. I know all of you probably would have heard about something, but let's see a kind of formal introduction. What is artificial intelligence? Then I'm going to talk about a little different areas of AI which are dominantly used in medical applications. So for example, machine learning and artificial neural networks, then natural language processing and generative AI, which has become a very popular topic these days actually with the introduction of tools like ChatGPT. Then medical applications of artificial intelligence, what are the use of AI in medicine, and then role of the doctor amidst of this new technology, right? And then what are going to be the future trends and some of the challenges, right? That is what I'm hoping to cover in today's lecture. So let's first of all, what are your thoughts? I mean, you think that AI is going to significantly change the way you work? Or is it going to be just something that we can leave it aside? For people who want to use AI, they will use it, but we don't care. We can continue our normal way of working. But remember, with these kind of technologies, your patient is going to be more knowledgeable and up to date, right? They may do a background search. They may, before consultation, they may use ChatGPT and then come to you with a thorough understanding about the possibilities and, important aspects of the condition that they are suffering from, right? It may not be accurate diagnosis of the condition, but they will get some information beforehand. They will try it out. So therefore, that is also definitely, so that is why I said that we can't just ignore this and we need to keep ourselves aware of what's going to happen. So what is artificial intelligence? This is actually a kind of simple definition of AI. Artificial intelligence refers to the ability of the machines, that is computers and associated devices and technologies, to simulate human intelligence. Now, I would like to highlight that it is not actually going to match or, really work on the principles of human intelligence. We know how strong our intelligence is, right? What kind of learning capacity that we have. So therefore, this word is very important. It is a simulated intelligence. So it's not actually a real intelligence. So therefore, we can never, ever replace the rationality using AI, right? You may mimic rationality, but it's not the true rationality, right? For example, the deep understanding that we have on a subject area, right? Ability to self-discover without any facts and figures. For example, our brain can even, generate a thought process on something completely novel. Whereas AI will be nothing if they don't have existing data. Actually, AI becomes strong today is because of the data sets that are available, right? Whether we like it or not, a large amount of data is available and collected as we behave in the society today. For example, from social media, a lot of data is collected. So this data sets actually has enhanced the inferencing capabilities and the learning capabilities of these machines. That is actually why in the recent, if you look at this decade, it has become a buzzword. Everyone talks about AI. Now, for example, I think government is talking about a national AI policy, right? National AI policy, because everywhere in the world, they know that the next, probably next transformation is going to happen in this particular area. So therefore, definitely, medicine also will have a significant impact. So it is a simulated human intelligence that is derived through learning from data set, right? So the existing data sets are used to learn. I will tell a little bit about how they learn in a little while, but they learn patterns and trends in data, which can be used for automating the decision-making process. For example, based on the data what is available from the past patients, we can use that data for making predictions in the future, right? So that is, you simulate your rational decision-making by analyzing patterns and trends in data. Okay, so I hope you got a basic idea. So you should not worry too much about it, right? You will never think that it will basically, some people talk about, AI machines will take take control over the world, right? As humans are, most basically intelligent species on this planet, we should not have a phobia or threat like that. We can always stand on top of these technologies if you are basically if you focus and drive yourself in those directions. So let me tell you what are the main technologies, key technology that is used in healthcare. I would like to talk about these three areas because these are the three main AI technologies which are applied in healthcare. One is machine learning. All of you have heard about machine learning. So this machine learning, deep learning, artificial neural networks are basically trying to understand patterns and trends using existing data sets. So that is having a great application from diagnosis to image processing to all these applications can be done machine learning is probably the core of artificial intelligence. In everywhere you have machine learning, right? How they do learning will vary, which we'll talk in a little while. So that is one of the key AI technologies used in healthcare. Another very important technology is natural language processing. Ability for machines to understand native languages like our English language and voice or maybe text-based communications, they can interpret, they can understand, and they can come up with basically generating words or meaningful paragraphs or sentences using natural language processes. So that is natural language interpretation is also part of this, and natural language generation also part of this one. So therefore you can really, this can enhance the human machine interface. I mean, how we interact with the machine. Now those days actually we had to use the keyboard to interact with your device. But nowadays you can have voice, you can speak to your device, right? That is because your spoken voice can be interpreted by using NLP systems. Now this NLP has predominantly become very popular in this particular recent past with the generative AI concepts with the tools like ChatGPT. So generative AI really has boosted applications of natural language processing. The other area is robotic process automation. We know that in every organization, even in hospitals or any enterprise, maybe private or public sector, there are routine work that we waste a lot of time, most of the time doing that. I know that all of you are updating the health records, and now currently maybe the medical records are all kept in paperwork. But if you have to do this electronically, that is some repetitive work that you will waste a lot of time on your day-to-day routine. So we can have software bots, right? That is software bots to take care of these things, right? So that is actually called robotic process automation. For example, now sometimes if you call a company call center, your call can be answered or responded by a bot. So you don't need a human to do that because it's a basic set of questions that you need to answer and direct you to the relevant place. Note that it will not give you the final solution, but it can build a conversation and identify what your problem and where it should be directed. So these kind of things also, for example, now say when you have taken healthcare, preparing your claim or the bill. If you're going for insurance, what is covered in the insurance and what is not covered in the insurance. And you're preparing your hospital bill, right? That has so many components that is going into it. And accurately preparing this one, if human does that, there can be some errors that can come into that. So we can replace these kind of thing by using robotic process automation. So this is basically the three key areas which I want to elaborate a little bit more. So let's start with machine learning and artificial neural networks. Right? Machine learning is actually a very strong branch of artificial intelligence which is using various methodologies, techniques for learning patterns and trends using data sets. So one of the earlier way that they learned is by, algorithms, right? Algorithm is a kind of a formula or a recipe. It can be using based on statistics or maybe various techniques like classification, regression analysis. There are so many algorithm models that are available. So you can learn by using these algorithms. That is also machine learning. But nowadays, actually, they learn without using algorithm. You need to give a little bit of, a procedure kind of thing to help them learn. But they came up with a model called artificial neural network, right, which is actually resembling the human brain on a computer. And this is able to self-learn from a data set. That is the interesting phenomenon about artificial neural network. So now if you say machine learning is mostly based on artificial neural networks. Of course, there are so many models of ANN. You talk about number of models of artificial neural networks, but machine learning now predominantly, algorithms also can be used. Sometimes algorithms and artificial neural networks can be combined together to have more enhanced learning process. But however, this is actually help machine to learn from existing data set. So there are numerous applications of this. For example, I told you, making predictions based on past history, past clinical diagnosis of a patient, right? For example, we can make a prediction about incidence of cerebrovascular disease or cardiovascular accidents for diabetic patients. Right? So if you have a good data set about diabetic patients who have had cardiovascular accidents, we can use that data set for training a neural network. And then we can use that for making predictions. So let me elaborate that on a little bit. So machine learning, artificial neural networks, and deep learning, all of these are related technologies, which is actually having a major application in medicine. So let's see, I told you that our artificial neural network resembles human brain. So all of you are familiar with this one. Of course, for me, actually, this is a little bit now, old knowledge because I have stopped practicing medicine in 2006. But anyway, still I have my foundation. So we all know that, how our brain consists of an interconnected set of neurons, right? So normally a neuron will receive all stimuli from these dendrites, and then if it gets stimulated, right? If it generates action potential, it actually triggers output goes via this axon, and it might trigger a kind of target organ or maybe another neuron, right? So this is basically how a neuron works. So what they have tried to do is in artificial neural network. Now these are biological neuron. They have tried to mimic the same thing in a computer system by modeling this mathematically, right? So we know that our one works on biological, neurotransmitters and, electric potential. We talk about all these things, right? But whereas this one is now modeled in the brain using mathematical model. Now this is example of that. So same concepts are there here. So now if you look at this is your, computer neuron. So like our nucleus in our neuron, it has inputs. So x1 to xn are all inputs. Now these inputs can be, normally we work today also, we are still working with binary in computer. So the input signal is there means 1, input signal is not there means 0. So that these will record whether that input, example, let's say whether the patient is smoking or not, whether the patient has a family history of diabetes or not, whether the patient is basically, having regular exercise or not, right? Whether consuming alcohol or not. So these are inputs. Then associated with these inputs, there are weights. Weights is actually a connection which is saying how strong this particular factor connected with this neuron. For example, let's say there is a very strong correlation between smoking and cardiovascular accidents. Right, you can actually have a stronger weight, but remember that we don't set the weight by ourselves. We start with random weights, and what happens in learning is based on your data sets, these weights are adjusted. That is actually the interesting phenomenon in this neural network. The weights are adjusted based on the available data set, so that they will learn the pattern by itself. So whether there is a strong correlation or a weaker correlation. Now, for example, if there's a stronger correlation, this weight associated with this connection is increased. Otherwise, the weight is decreased. So if the total sum of weights coming on this particular neuron is above the threshold level, now normally even our neurons will not discharge unless the action potential comes to a certain level. So here also there is a threshold limit. If the threshold limit is surpassed, this particular neuron gets stimulated. The computer neuron gets stimulated, and it will send a signal via the output line. So this is basically the basic structure of artificial neural networks. So there are incoming signals. With each of these connections, there are associated weights, and these weights are changed to learn the patterns. Now, so it's not a single neuron that actually gives the solution. It's a network of neurons. So you have input layer, you have hidden layer and output layer, right? So that will basically, for example, let's say output layer can say whether you have a very high risk incidence of cardiovascular accidents or low risk. So if the weights can, based on your characteristics, if the tendency is more towards you to have a high incidence, the stimulation will stimulate the upper neuron. Otherwise, it will stimulate the lower neuron. So that's basically how the neural network executes. Remember, this happens through what is called training a neural network. Right? You all also can now do these things very easily because these models are now freely available. Right? If you go and search for, accessing a neural, paid services are available for you to just access a neural network. And you just provide the data set and let it learn. But remember, always when you are learning, if you have a data set of 1,000 patients, remember, we can't use the entire 1,000 patient data set for training the neural network. I had to group this into two parts. One is called the training set. The other is used for testing or validating. Because we must test once you train whether this has been trained properly also. Sometimes it can be overtrained, it can be trained less. So therefore you need to look at these things. For example, let's say I can train with 800, then the rest of the 200 can be used to test it, whether it has been trained properly or not. For example, if you have false positives and false negatives, all of you know what is false positive. Let's say, for example, false positive is where I should not say, there's a high risk. If it says there's a high risk, that's a false positive. So there can be false negatives also. So if you can minimize your false positives and false negatives, you can say that your neural network is very well trained. Now, once it is trained properly, you can use it for making the predictions. So I have explained how artificial neural networks work. Now, if you see, for example, now this one, based on the input parameters, the neural network, it shows that, how just with animation, how this, based on the input, it decides whether the animal is a dog or a cat. Right? So these are let's say, for example, based on whatever features that you input, you decide what the animal is, and this neural network is trained for doing that. So what are the applications of artificial neural networks? From making predictions to making diagnosis, even discovery of new medicine, drugs, right? You can use artificial neural networks. Even, for example, now, today genetics have a lot of impact on healthcare, right? We always try to trace down whether there is a genetic association for any kind of disease. Now, these things have become very easy with artificial neural networks. Now, those days, genetic sequencing and things like that takes a lot of amount of time, even with supercomputers. But nowadays, with artificial intelligence, this can be more rapidly worked out to discover whether there is any association for certain diseases. Right? Now, you may also want to learn what you mean by deep learning. So, machine learning, artificial neural networks, they are, artificial neural network, one of the way of machine learning. So, deep learning is actually trying to understand, sometimes, correlation between certain things. For example, just because there's a growth, that growth, you can't say it's a malignancy, right? So it's a malignancy, you can't say. So therefore, sometimes the association between our data is not very straightforward. It's not black and white. We call such data as unstructured data. I think in medicine, right now, for example, even if a patient is presented with a very classical symptoms of a heart attack, you can't 100% confirm and say this is a myocardial infarction. Right? You need to do investigations and probably confirm that one. So there is no black and white theories in medicine, as I am aware of. So therefore, your relationships are more complex. So therefore, you need to use more advanced learning concepts. Especially what happens is, if I told you that the neural network can have multiple layers, if your association between these input characteristics and the outputs are complex, just one hidden layer may not be enough. Because there's not a straightforward relationship. So you may increase the number of hidden layers. So that is actually multi-layer neural networks can be used to understand complex patterns. So that is what is called as deep learning. Right? Especially, for example, nowadays, medical imaging has made a very significant advances with the use of AI technology, especially your MRIs, scans, and these imaging, as well as various other diagnostic. For example, now if you have Holter monitoring, right? If you do Holter monitoring, actually, Holter monitor report comes a big report. But so rather than manually going through it, you can actually feed the Holter monitor report into a trained neural network and to see whether there are any abnormalities that you detect in this one. So basically, these are deep learning techniques because associations are not very simple or straightforward. That is why we will need deep learning techniques there. So the next area we have covered artificial neural networks. So you actually will see a very interest with artificial neural network technology because it's very much connected with the human biology and it's actually built upon that foundation, right? And where a lot of artificial intelligence work has happened from that one. So the next one is natural language processing. I told you NLP is basically ability for you to understand human language. Human interactions are made. It can be either text-based or it can be voice, right? Speech recognition, text generation, text classification, right? You can do that. For example, now let's say you have a health record. Now, when you look at a health record, it has so much of things in this health record. Part of that may be the patient's history. Part of that may be your investigations that you have ordered. Part of that may be the consultant's notes, remarks that they have made. Part of that can be the medication or any procedure that you have recommended. So, actually using text interpretation and text classification, these things can be easily separated and you can extract them. And you can record them appropriately. Okay, this patient was introduced a new medication plan since this particular time. You can extract that from the health record very easily because of advances in natural language processing. And also, for example, now sometimes a lot of patients, now we talk about personalizing the care, right? Now sometimes, certain patients comes with certain allergies and various types of other past history where we have to be careful of. Sometimes actually we may have identified that one, but we may overlook that at some time when you are making your decision. So those can be actually sorted out. You can be prompted to identify if there's, for example, if you have prescribed something contraindicated in a given condition, that can be prompted. So that sometimes because we know that we have very limited memory, right? We can't not like now if you ask me what are the all possible causes of a short of breath, you will not be able to give it offhand. But so AI will help you to, these minor areas which you have probably forgotten can be prompted and get your attention into that one also. So that will give you real assistance in giving better care and better diagnosis in your patient rather than becoming a threat to yourself. So NLP is going to actually enhance the human-computer dialogue, and that is how actually now we can have virtual assistance for taking care, post-palliative care or whatever care. You can have actually AI-supported assistance where interactions between the patient and the device can be via voice. Interaction can be between the patient. So therefore, they can easily, just like they are conversing with a human, they can interact with the device. So I told you about this generative AI. So generative AI is nothing but amplification of your natural language processing capabilities, right? Now they use a type of neural network called transformers in generative AI, which is the ability to interpret text, images and all those things and generate them using generative AI compare. Now today actually if you want, you can even give a text and ask them to generate an image relevant to that particular text using generative AI, right? So which is and also able to interpret images, right? So in currently image interpretation is not very perfect, but text interpretation and text generation is actually impressive. Right now, actually, I today morning I just used ChatGPT. If you have used the paid version of ChatGPT, just ask and see. For example, I just today asked from ChatGPT. Apparently, a healthy person who have been healthy for the past months, right? Just present to you with sudden short of breath, right? I wanted it to give a differential diagnosis. right? It nicely gave, what are the possible cardiac causes, what are the possible causes from, chest, all those things were nicely, anemia, everything. I mean, I really, recalled all my medicine which I learned decades ago when I saw that one, because our foundation is strong. So sometimes what happens is that we are not up to date in our knowledge. So that really helped me to, when they gave me that differential diagnosis, I really, got updated. Okay, these are all possible lines that I need to think, and it was presented very nicely. Then I asked, because I worked in an intensive care unit when I was doing my first appointment, and I used to do CVP lines, and I asked, tell me the correct, what are the precautions to take when you are inserting a central venous pressure line. So they gave nicely from position to everything what you need to take care of, what are the possible complications, and all that was given nicely. So that's actually how it can help you. So remember that now this is the same thing that a patient also can do, right? Patient also can do. So basically, that is why you have to be careful, and you need to explore these things. That's what is important. Be little inquisitive about these things. So free version of ChatGPT anybody can use. So just question it and see, right? What are possible questions patient can ask you. So even in your general practice, sometimes this might be helpful, because then right? This kind of knowledge can be with the patient. So this is generative AI. So what are the applications of generative AI? So the applications of generative AI, you can drug discovery, right? So discovering new molecular structures and accelerating drug discovery you can do with generative AI. And also you can synthesize data sets. For example, sometimes we have in medical research, we have a lot of issues with regard to having the right amount of data sets for doing our trials, maybe doing our testing, right, for research purposes. So sometimes ethical clearance becomes a very big issue in health research, medical research. But nowadays actually you can generate a data set. Right? You can use, I am not telling that you can complete your research using a generated data set, but for you to do a pilot, right? For you to do your pilot, you can have a generated data set which can be easily generated by using AI. So that's how this can help you. And also the important thing is AI-driven medical education. So I think AI can simulate your patient. Now we know some countries. Now, of course, we are fortunate. Actually, our medical training, we have got a lot of hands-on approach, because we have plenty of cases when you go to our hospital. But it is not the case in the West. So sometimes they don't really hardly have physical access to the patient. So we don't want to produce someone who doesn't really have that exposure. But you can supplement. I'm not telling that this can replace real interaction with patients and real, interventions that you do in the hospitals, but you can supplement the training. So medical training, education can be enhanced by using AI technologies with this one. Recently, actually, my son did a research. He has developed simulating dental patients for dental students by applying AI. So that, when we were medical students, I remember that our consultant used to stress how important it is your clinical history taking. Sometimes we tend to forget some of the questions that we should ask. But this really trained the medical student, and give feedback on what he did right and what he did wrong, right? So that is basically how we can enhance with generative AI applications. The other thing that I was talking about is robotic process automation, RPA. So this is basically, sometimes we deal with a lot of high volume data, right? Routine things, sometimes which are becoming cumbersome, and, human error can cause a lot of problem in these cases. So you can use software bots to automate this. For example, now, if you take a hospital, managing your inventory, right? It's a routine thing, right? Managing your inventory. You don't want to run out of stocks of important medication when you're operating, let's say, imagine that in a theater, right? All your important stuff has to be there in the theater inventory, right? You need to go to the central supplies department and get all of those things. Sometimes, we don't need to involve human for doing this. We know what the movement for a day or movement for a week, and based on that we can actually predict what the requirement for the next week, right? Not be just a formula. It can be a prediction based on the timing of the day, the number of cases that has come, whether it is increasing, decreasing. So these kind of things can be automated. Scheduling appointments, you can automate. Billing, claims, payments, all these workflows, which takes a lot of, even updating electronic health records. Now sometimes we have a lot of compliance requirement. I know that if you have a communicable disease, we need to notify. Right, and we need to basically, if it is sexually transmitted diseases, you need to make certain compliances with the health authorities. So you have to fill a form and then you need to send this, that's the notification mechanism. But, as soon as you select your diagnosis, that notification can be automated, right? That is basically through what is called robotic process automation. So what is important about RPA is actually we can get the doctor to do the real job, what your intelligence and what your rationality is needed. Ultimately, what is the most critical thing that the doctor has to do is ultimately making the rational decision based on the circumstances and instruct your team on what to do. What are your priorities and what you should act. I know in the intensive care unit, when we get a critically ill patient, it is my decision making that is most important. And if I can do it as fast as possible, you are doing a good job. But sometimes what happens is when you go to do these routines, right, you might actually miss out your priority, because these routines are also important, because sometimes you might have an investigation because of the routine, not because of the wrong judgment that you made, right? So because of that, sometimes we tend to allocate unwanted amount of time for this routine work, which will basically take your focus from the most important thing. So that is where these kind of technology, robotic process automation, can help, where really your attention can be brought into, even for example, now let's say in an image, I might be looking at an image now we take a lot of cross sections when you take MRI, right? If I can really, some tool can assist me, there is some kind of abnormality seen in this particular section, I can more closely look at that rather than just scanning through all sections in the MRI. So this is where basically these kind of technologies will help. So let's elaborate a little bit more about some of the medical applications. So I told you about diagnosis. So we can use making diagnosis. We can find associations between, now today, clinical histories, genetics, all those data can be integrated. Now if you see, for example, now when you come across a patient, you can only, what your diagnosis is only based on your history, your investigations and your findings. But imagine that this can be combined with genetic associations, right? Your diagnosing capabilities are much more enhanced, right? So that is what AI can do. It can take all your past history of patient, all hospital admissions and all associated factors, your family histories and all those things can be integrated and learned in a more complex way. Humans cannot handle that much of volumes of data, but this can basically do that. That is why your diagnosis can be more enhanced. But remember, it says diagnosis can be enhanced. It doesn't mean that you can have automated diagnosis. We should never rely on a complete diagnosis what comes from a machine. You have to actually, ultimately, the judgment has to be made by an expert, which is a human expert, who should look at all those things and make a sensible judgment on that. Then treatment personalization, I told you, right? Sometimes, they talk about, when you go to a hotel, right? Based on your social media preferences. Now this is the level to which the hospitality industry has grown, that when you go to the hotel people know what your favorite dessert and what that, and you will be welcome with that kind of a drink if you love that. So that is, so you feel delighted because such a personalized service they can give you. But you might again talk about, it's about privacy and they know all about your behavior and all that. But this is how the industries have grown, right? So treatment personalization, we know that treatment personalization is a very important thing. right? For example, now let's say sometimes when you prescribe certain medication, I had a recent actually incident where I was actually on a anti-hypertensive drug, where actually for my context that was not the best drug, right? So however it has been overlooked, however that I was on that treatment, right? And it is because of a certain incident that I really had to investigate why I'm taking this drug and so on. But that was not the best for me. Then later on, the consultants who are seeing me suggested that, okay, you should have been best in this on this particular drug. So these kind of things, treatment personalization, your allergies, your drugs which are not ideal to be given in because sometimes we talk about a lot of side effects from one drug to another drug and all those things. So sometimes getting the right balance is not easy and not complex. So not easy. So this is where treatment personalization in medicine will help. Remote monitoring. AI systems can help to monitor patients remotely, right? For example, we talk about virtual nursing assistants, right? Where you can, and also nowadays you can have a lot of wearables which you can use to. Now there are even wearables which you can have them as patches which you can monitor. So you can have ambulatory monitoring very easily by using these wearable devices. So you use technologies like Internet of Things to connect these wearables with the remote device. Now even, for example, you can have wearables which you can ingest. For example, now we know that a lot of issues with the patient, sometimes they throw the medication, right? They don't really, especially for example, psychiatric patients, right? They don't bother to take that. So you really want to see whether the patient really ingested the medication or not. So your chemical changes in the intestines or your stomach can be recognized by such a device, a sensor which you can swallow. Right. So these are the tool. So therefore, remote monitoring, because you know how important monitoring today, right? Definitely monitoring in hospitals is also important, but post follow-up monitoring is also important. Sometimes the patients are very negligent. When they leave the hospital, they think that they are back to normal and they don't take any precautions as such. So this is some area we can actually have AI. And then another thing is actually robotic assisted surgery. Now, some very advanced medical centers have even tried out robotic assisted surgery. Especially, it is not something that you can do for everywhere, but especially in very tiny areas where you need very high precision and control for the surgeon. Right? You can actually, surgeon doesn't really operate on the body of the patient, but the surgeon really operate a machine. So this is actually robotic assisted surgery. This is not a surgery without a surgeon, right? Robotic assisted means surgeon really doesn't do the incision on the patient, but the surgeon manipulate a robot, right, using more three-dimensional views and enlarged views, and he have more precise control over the area and does the surgery. So this is also possible, and things like prosthetic surgery, they are successfully minimal invasive. Maybe certain laparoscopic surgeries you can do by using robotic assisted surgery. So therefore, even they are talking about remote surgeries now, right? Remote surgeries is that actually surgeon doesn't come to the theater, but you do that virtually. So I don't know to what extent. So remember, these applications will require a lot of regulatory and ethical clearance, right? So nowhere in healthcare, unless these use is legalized and approved by the authorities, this level of artificial intelligence will never be used. For example, autonomous cars. Right? Autonomous cars, although it is available, autonomous cars can't be on the road unless the traffic authorities give approval. So therefore, if an autonomous car come to that extent, in healthcare use of AI need to be carefully evaluated and decided by the relevant authorities. Okay, this we are going to try out and on this center for this particular purpose. I would like to, since I've been talking for a long time, just share this video. This is about robotic assisted surgery. You can just have a look for next 2 minutes. I hope you all can hear. I can't hear. Sorry. Sorry about that.
Of diseases including prostate cancer, kidney cancer, adrenal cancer, and complex urologic reconstructive procedures such as pyeloplasties.
Can you hear now?
And renal reimplantation. Robotic surgery benefits the surgeon in different aspects. First of them is avoiding surgical trauma. When we do some sort of operation, there is some trauma that disappears when you operate a patient under a robotic platform. Second advantage is the magnification of the operative field view. This is a 3D magnified image that we obtain through the robot console. Third important aspect of benefit to surgeon is better ergonomic. Surgeon is sitting in the console and is doing his procedure comfortably.
We do the procedure that's best for the patient from a medical point of view, but the approach has to fit the body habitus of the patient. So not every patient is a candidate, but the candidates have to be chosen carefully through a multidisciplinary approach. The advantages of the robotic approach are decrease in the amount of blood loss, decreased time in wound healing because the incisions are very small, very little pain, and no restrictions after robotic surgery.
This technological leap has transformed the care of our patients. Safety is improved, the quality of the operations better than ever, and our patients benefit. They leave hospital and return to their lives with their families and in their community much more rapidly than was ever possible before robotics came into being. At Cleveland Clinic Abu Dhabi.
Right. Okay. So I think you just got an idea, how a doctor, surgeon can be, his capabilities and his work can be made more easier, comfortable, and also more beneficial for the patient by using that. So these are not, applications all across, but there are some things. So let's talk a little bit just for us to wind up role of doctor amidst of AI. So I mean, what you need to think about is AI not as a threat. You have to think about how AI can assist you, right? So you have to use AI as a support tool. For example, you can, you need to make your complex decision making, rational decision making, but your routine repetitive tasks, right, can be really get supported by AI. And also you can, get yourself updated with your knowledge with AI. Sometimes if you go to read your, nowadays you don't probably go to read books. If you are a practitioner, you don't have time to do that unless you're doing further studies. So you can really get a, quick update on something, but don't 100% rely on that. Please cross-check that one because you can't always guarantee that all information is perfect. But you have the rationality for you to identify if there was even a wrong prediction, all right, wrong information that is there. You have the good foundation, so you should be able to eliminate that and take the rest of it. So this is how you can use AI as a supporting tool. And also, what is important is that you need to actually, doctor and AI need to collaborate, right? So therefore, you can basically, some of the work like personalizing your diagnosis capabilities, how fast you can make your diagnosis can be enhanced if you collaborate with AI. Right, and so therefore you'll be able to sometimes as doctors your workload is very high because you have a lot of administrative work as well as your clinical work. So sometimes that work stress and work pressure can be reduced, right, by taking care of those matter. Now, I remember that when we do when you're doing a particular appointment, let's say, sometimes number of admissions that you get and the amount of work that you have to do in clerking those patients is huge. It's more than your rational judgment sometimes, right? So you can actually collaborate with AI and get some assistance. So future trends. So what are the future trends? So probably actually, as I told you here, AI can be used to give more personalized care for patients, right? Understanding their background and their context and their genetics and their history, their associations. All of these can be taken into consideration. Sometimes that broadness in decision making, human cannot do. But AI will be able to do that. And AI in genomics, I told you about, being able to identify genetic associations for diseases will now be easy with that. And also, for example, in terms of doing treatment and drug research based on these chemical identifications and genetic identifications. And AI in mental health. We know a lot of mental disorders, you need a lot of real-time monitoring, so it's probably a long-term process. So you can actually use AI in treating people with psychological abnormalities. So these are some of the future areas. So especially AI in genetics is a very big area, right? And also personalization of healthcare, imaging, diagnosis, predictions, those are other areas, and AI in mental health. But some challenges are also there. For example, as I told you before also, like ethical concerns, right? Whether it is right to use this or not is a very important thing. So need to have concerns about this. And we can't use AI, without the knowledge of the patients. You need to really, have adequate transparency. So that is important. And also regulatory clearance, government and healthcare authority clearance has to be there for using AI technologies. And privacy is another consideration. I mean, whenever you use AI, we are actually getting that AI power using data sets. So we need to use data sets for training neural networks and, understanding that classifications and patterns and trends. So there are issues with regard to use of such data. So, I mean, patients' data ultimately coming from various healthcare institutions have to be used, right? For example, sometimes the data what was used in the West may not be perfectly suitable for our predictions, right? Because we are a tropical country and our socio-economic context is completely different. So in that context, the accuracy of the predictions of the neural networks used in the West may not work. So we'll have to do this exercise using our own data sets. So then we have to get ethical clearance and the privacy issues. Now, for example, in Sri Lanka, now there is a Data Protection Act. But only thing is, although the act is there, still there is no data protection authority for enforcement, right? So therefore, we are still actually at very early stages in these cases in order to really apply them in the real life. And also, the other important thing that I want to stress is that as medical practitioners, now you also need to you can't say that I'm a person with biological background and I'm not a techie guy and I don't want to be associated with technology. That phobia need to be removed, because modern world actually technology is there. Even if you buy a motor car today, that a lot of technology. So therefore, you have to actually see how technology is going to have an impact in your profession, and that skills gap you need to really update. So I think this can be an eye-opener for you to see how AI will have an impact on healthcare. So keep yourself updated. Your domain knowledge update is also important, and also technological updates which can have an impact on your profession is important. So that is the other challenge that you will have. So this is just, I want to show you what AI can do just as a last. I mean, if you see this one, this is actually an AI generated avatar, which is actually, you can see.
AI will significantly reduce the workload of doctors by automating repetitive tasks, allowing them to focus more on critical decision-making and personalized patient care. By serving as an intelligent assistant, AI can enhance accuracy and efficiency in diagnosis and treatment planning. This partnership between AI and doctors will not only improve patient outcomes and make healthcare more efficient, but it will also support doctors in their work without replacing them.
Okay, so this is actually the text that I gave, and got this avatar to read it out. So you can see that the facial expressions, lip movements and all that is generated by AI. So which is basically, so for example, some of the jobs like newsreaders, right, you probably can replace. right? So you don't have to worry because healthcare is one of the role of the doctor is not something that you can replace with any of these technologies. But whereas some of these jobs right now, for example, this will not have any error in reading a script. Will nicely with adequate pauses and fluently will read it out. So we can easily use such technologies. So I think you probably got, it's not a very comprehensive coverage of all AI in healthcare, but I wanted to touch upon what are the AI main technologies. Like we talked about machine learning, we talked about artificial neural networks, NLP, generative AI, and robotic process automation, and how such technologies are used in AI. So okay, so if we can take up any questions that we have, and also in future also if you have any queries or doubts, you can take it. I hope that you all got some idea about AI on healthcare, but a lot of information is available. So for example, you can simply use the free version of ChatGPT or Gemini, which is on Google, and just chat with that and get some updates about how technology can change healthcare. And then if you go to search on Google, you will find enough of related information relating to this one. So on and off, I've been for you to keep away from your domain. Make it a habit of just watching a video or maybe reading something related to that one. Then you will build an interest. Actually, there's a lot of room for medical related research on this area. I mean, if you are doing any advanced studies on these areas, so there are a lot of room for people to further evolve these technologies.
Thank you very much, Dr. Dayan, for that very interesting lecture. And we have received a few questions from our audience. The first question is, as medical practitioners, what we mostly do is pattern recognition, applying already identified treatment regime and adjusting treatment with the feedback. So all this is already possible with AI. So what would you say about job security? That is the first question.
Yeah, so actually yeah, now here basically, although we always say that it's about our patterns, and we and those based on patterns we treat the patients, but I hope all of you agree that in clinical presentations and all of these, you have a lot of variations. You don't have these typical textbook presentations of cases, right? So that is where your job will be there, because rationality, human rationality, comes not only from your domain knowledge. So if you say that you're only using domain knowledge in treating the patients, right? We don't use only that. We use a lot of common sense, right? That's called tacit knowledge, right? So we use that also sometimes combined with that to make a judgment, right? What is the best in this context, right? So therefore, that's why I told you at the beginning also that this cannot really automate the complete therapeutic measures what need to be taken for a presented case, right? It will give you possibilities, it will guide you, but ultimately, right, we will not let a machine decide. I don't think anywhere in the world that will be granted for a machine to decide ultimately what is the treatment, line of treatment, and what you're going to do in that one. So this will give all assistance. Ultimately, a doctor has to play the role in making the rational judgment. I don't think the judgment, for example, let's say that now if you, in that context, you can say that all the judgments in the courts also will be based on the past laws and acts and hearings. So in that case, we can have automated person giving the ruling in a court, but that will never be allowed for this kind of highly intellectual task. Nowhere in the world that this will be authorized to be done. So therefore, you don't have to worry about job security.
The second question is, when AI assisted in treatment, errors are possible. And when a mishap happens, what would be the legal implications?
So that's why now we won't really get the machine to ultimately make a decision, because if a machine makes a decision, then there's no one to be blamed. So actually machine will be used as a supportive tool. So ultimately there is a human, whoever the doctor or in charge of that particular unit will have to be responsible, right? So even if the machine, that's why I always say that ultimately whatever predictions of the machines have to be taken through by a doctor who need to, for example, let's say MRI imaging, we get interpreted by a machine. But then ultimately a consultant radiologist will have to go through that and authorize and authenticate that. So then ultimately that will go under that particular consultant radiologist responsibility. So because we can't give this responsibility to a machine, right? So therefore basically the responsibility will have to be taken by the practitioner.
So the third question is almost overlapping in sense. As artificial intelligence is over the horizon, will there be a place for intellectual professionals in the future?
Definitely yes. As I told you that some of the jobs in areas like medicine, engineering, where highly intellectual capability, rational judgment is needed, right? I mean, yes, jobs, landscape of the jobs will change, right? Definitely it will change. So even as a doctor, what you do will change, right? What you do will change. You will not, probably will be spending too much of time in updating patients' records and, making appointments, giving the next clinic dates and follow up on all that. You will not do. But you will definitely play the role of a doctor in a much more comfortable and assisted environment. So if a job is going to be impacted, I think the impact will come to these kind of professions like medicine, engineering and law at last, right? I can't actually still give a comment on that one right now, but it will definitely not replace. It will generally, what will happen is that your role will change. What you do as a doctor, your role, what you do and what you not do, right? Those things will only change, but the role will remain. Before your jobs are going to get impacted, there will be so many other industries and jobs that will definitely will be wiped out by AI. So those who are working in banks should have a lot of worry. Those who are working in other industries like, for example, customer service, right? They should worry, right? Because their jobs will be completely replaced by these tools, but not your profession.
The next question is, are there any AI courses that we can learn further?
There are actually AI courses. If you go for best way is to learn online. If you go to the sites like Coursera, they have AI courses. But there are some universities also for professionals. I think even Morato University has certain AI courses which are available for professionals, right? Like there are postgraduate diplomas, right? So if you're interested in following a local course, that is available. But I think best is because of your busy schedule, doing something online will be the easiest.
And there's another question. Sometimes during Zoom meetings, there's an AI companion who takes the summary of the meeting and gives a report and send it to the email. Will this breach the confidentiality of that meeting? The question.
So I think that is your choice basically. So that is a tool. So if you don't want the assisted minute taking of the meeting, you can disable that option. So always a choice is there. So it's like we before doing something we take consent from a patient, right? So similarly, if my meeting to be recorded, I have to opt in. If I don't opt in, right? Even your meeting to be recorded, you need to opt in. If you don't allow recording, it can be controlled. So therefore, it is at your discretion. So you can control that.
Any chance of AI overriding human control?
Not, I don't think, because if these all machines are made by humans, right? So we know that we will never basically create some device or gadget which are going to, basically a threat to your own self, right? So it's basically you are making them. So therefore, it is under your control. Unless your AI devices are going to be hijacked by some alien species, right? As long as these AI systems are under your control, right? I don't think it will become a threat to you, right? So is that just like, no politicians will create another politician who will become a threat, right? So you always plant only someone who is not a threat for you, right?
So I'm asking one last question. Will there be a Skynet awakening?
Sorry?
Skynet awakening. I don't.
That of course I'm not exactly sure about that term. I'm sorry.
Okay, that comes to the end of the question session, and let me thank again Dr. Dayan Rajapakse for coming today with your busy schedules and giving us a very nice and very interesting lecture. And thank you so much, and we would like to invite you for future lectures as well.
Yeah.
Thanks a lot.
Thank you, Charni. Thank you for the invitation. Welcome.
Thank you, the audience, for being with us and sending us questions and being so interactive. And see you in 2 weeks' time.